Hi, my name is Jessica Drummond. I'm the founder and CEO of the Integrative Pelvic Health Institute. I'm here to help you have more success with caring for your complex women's health patients and clients. I know you. You are a very hardworking health professional who likes to get the best possible results for your patients. It makes your day to help people. You just want to see your patients feeling better. You've already got some great education under your belt, but you're not a machine, even though the hospital or practice where you work would love to think that, right? So sometimes you hit a plateau with what you're able to offer your most complex patients or clients. Those cases are hard. Both you and your patient or client feel frustrated, and it can kill your confidence when you don't know what to do next and you're not getting the results that you expected for your patient. Sometimes even the best foundational education can leave you unprepared when it comes to taking care of women with complex health and wellness issues. So sometimes you need specialist education that focuses only on the unique needs of women as they transition through life stages like puberty, first jobs, marriage, infertility, pregnancy, postpartum, motherhood, divorce, parent caregiving, mentorship, and menopause. And if the women you're working with are in the throes of transition, in addition to struggling with a chronic or acute health condition like pelvic pain, thyroid disease, fibromyalgia, an autoimmune condition like celiac disease or MS, osteoporosis, a recent surgery, or even cancer, you might not have the tools that you need to get them the results that they're seeking. It's not so much that your patients are difficult. It's just that often your difficult patients are struggling with the health issues that they're seeing you for, in addition to life's physical and emotional transitions that are just part of being a woman. Have you ever thought about how the woman in your office, who's 50 and seeing you for treatment of her osteoporotic wrist fracture, is concurrently struggling with the hormonal swings of menopause, the vaginal dryness that may be putting a strain on her sexual relationship, the transition in her role from hands-on mom to a teenager to faraway mom to a college student, and may also be transitioning in her first mentorship role at her corporate job, all while being charged with managing the healthcare needs of her mother, who was just diagnosed with Alzheimer's disease. No wonder it may seem like she's not following your recommendations, and no wonder she isn't experiencing the healing or results she's seeking. Even though she may be receiving excellent care, you may be doing everything right from your clinical treatment perspective. But there's a lot going on here, and if you focus on just one issue as her physical therapist, nutritionist, or doctor, you may struggle to get sustainable resolution even to her primary complaint, her wrist. Or take this example. One of my students was working with a woman in her 40s who was struggling with menopause symptoms, weight gain, especially around the belly, and hypothyroidism. Once my student understood the interaction between her patient's digestive system, immune system, and hormone system, she was able to help her client resolve her hot flashes and lose her belly fat. But it wasn't enough for her to just learn the complex multi-system interactions and how to support them with proper nutrition, supplements, and lifestyle tools. She also had to understand that getting to the root of her patient's stress, which was dramatically affecting her stress and sex hormone levels, required her to coach her patient through her divorce using skills like mindful listening and motivational interviewing. Coaching our patients, or knowing to who to refer to for appropriate coaching, if that's something you don't have time for or uninterested in doing, is a skill that's missing in most healthcare training programs. And coaching clients through relationship challenges, work transitions, or even just to help them stick to the lifestyle shifts like new fitness programs or new nutrition programs that you recommend is a key component to getting to the root cause of their physical symptoms. I would venture to guess that even the best healthcare or generalist coach or nutrition training in the world did not give you the tools to navigate these extremely common and complicated case studies without seeing the women in your practice holistically and having the tools to help them manage their complex and overlapping issues, there's no way that you can help your patients to get the results that she's seeking and get those results to stick for the long term. When that used to happen to me, I would feel like I failed her. And to be honest, I would just plain feel like a failure. The fact is, I'm a little type A and I like to succeed at things. But I wasn't a failure. I just wasn't a holistic women's health specialist yet. I was just missing some key pieces of the puzzle that have given me the expertise to work with patients like her every day with confidence, ease, and joy. I love working with the most difficult patients now. It's wonderful. With the approach that I teach in this training program, we move beyond the more masculine, productive, straight line, symptom treatment model and look deep beneath the surface. We consider each patient as a full feminine human being and take into consideration her physiologic, emotional, and spiritual challenges and her practical day-to-day issues. As a health or wellness professional, you can usually tell that there's more going on beneath the surface, but you don't know where to begin to speak with your patients. And you're afraid of opening an emotional can of worms that you don't yet have the skills to handle or the networks to support you in getting the help that your patient truly needs. If you're a health and nutrition coach, you may have protocols that you follow. But what about when your patient brings up issues that are outside of your scope of practice or beyond your skill set? Who can you refer to? Where is your network? I hope that this video has given you a few ahas about the complexity of being a women's healthcare provider in an age where women's roles are so rapidly changing in a world that still takes a primarily masculine, productive, and straight line approach to success and healing. In the next video, I'm going to show you the skills that are essential for overcoming your fears of handling both complex clinical issues from a holistic perspective and getting to the root physical, emotional, and practical challenges that are keeping you from partnering with your patients to achieve her ideal results. I'll see you there.